There's so many different aspects in regards to the PACT Act. It was very expansive. Also, they expanded out different locations for Vietnam veterans. That opened up the door for veterans who is in need of health care that could have maybe previously once were denied. How you are going to sign up for the VA health care is going to be very simple. But on the civilian world, you have the freedom to choose who you like. So please make sure that you get that identification card. Hello and welcome back to the Veteran Learning Center. Again, we're here to speak about our next segment and next topic of what we're getting into, right? So this time we're going to kind of roll out some illuminating aspects of VA healthcare, right? VA healthcare. I really love this topic, and why I love this topic is because there are millions and millions of people without healthcare in our nation, unfortunately, and we really are in need to make sure that we're taking care of one another. And being able to provide this information is going to literally possibly save a life, right? Early detection in some areas, and also getting the health care that you need on a day-to-day basis, also making sure that you get what you deserve. And again, healthcare access through the Department of Veterans Affairs, VHA, is one of the most illuminating things that I think veterans mostly do not understand, but we're going to go ahead and open that up, bust that door open, and make sure that our Veteran Learning Center knows and also understands healthcare access. So first, let's talk about access, right? Access. Let me tell you guys, this is a huge regulation change that just happened, okay? You're probably watching it, and you're probably watching this from your desk, phone, wherever, but this is probably long from now, but it transpired in March 5th, 2024, where the expansion of the PACT Act has garnered more healthcare benefits for our veterans, right? What is the PACT Act, you ask? Well, what it is, again, this PACT Act was a legislation that was passed to be able to serve as Gulf War veterans, Vietnam veterans, and open up the doors to again, healthcare that may have expanded across the nation. But most veterans did not know that they had this access. It was one of the most revolutionary changes in the VA healthcare system, which actually gave access points to a lot of veterans and also their families. Also providing presumptive issues to be granted from different presumptive conditions, right? Such things as allergic rhinitis, sinusitis, respiratory cancers, lymphatic cancers, right? Genital cancers. There's so many different aspects in regards to the PACT Act. It was very expansive. Also, they expanded out different locations for Vietnam veterans and also Gulf War veterans. So now when you say you need to be in a certain location, certain area, and if you have a certain diagnosis, well, guess what? You're going to be service connected. But now, I want to go ahead and also mention the expansion in regards to healthcare that just transpired March 5th, 2024. What it did, it broadened the scope of healthcare services that was provided and available to veterans, right? So if you served in that certain time frame that would be eligible for Southwest Asia service, right? Southwest Asia service. And again, when we're talking about Southwest Asia service, that means that's going to mean Kuwait, Afghanistan, Iraq, different places of that nature. When we're specifically speaking about our Gulf War veterans, what that does, that opened up the door for veterans who is in need of health care that could have maybe previously once were denied, okay? From one veteran to another, we understand that probably our veterans should not be without health care, basic health care services and needs. Well, unfortunately, there are many veterans getting denied for certain reasons, right? Again, it could have been financial reasons, okay? It could have been eligibility reasons, even eligibility meaning you may have received other than honorable discharge. So there's so many different components, factors, and access points of what made you eligible and what didn't make you eligible. So, but the PACT Act, back to the PACT Act, right? Again, it also focused on areas, okay, locations that were particularly exposed to hazardous toxins, okay? Hazardous toxins, particularly. So that means Agent Orange, okay? Agent Orange. That also means being exposed to burn pits. That was a big one. Let's talk about Desert Storm, right? Desert Storm veterans. These respiratory conditions and ailments and issues that you suffer from today, you may have access to health care that you may have not thought you had before. Well, let me tell you, you do. Okay, you do. And being exposed to these hazardous substances has definitely put you in position to make sure that you're able to take care of yourself or your family. Okay, because we're going to go ahead and speak about the PACT Act and provide you another course here in the Learning Center, specifically in retrospect of the PACT Act. Okay, we want to bring it up to par. We want to make sure you understand it, and we want to make sure that you maximize that legislation. Okay, without maximization, guess what? We are both not getting what we deserve. It's your service, your benefit. So let's access it together. All right. So continuing here. So when we're talking about the PACT Act, we want to also make sure we want to simplify it, right? We want to simplify it. So let's break it down here in regards to healthcare. Okay. If you were in a Southwest Asia area, okay, and we're going to make sure that you understand where that region is of locations in a certain time frame, which we're going to provide you down below. You can be able to pull those documents to understand if you meet the criteria, it's there for you, okay? That is going to give you access to service connection for certain presumptive issues, which will be, again, down below in the attachments that you're going to be able to access to understand, okay? But in regards to healthcare now, it opened it up for healthcare. Certain veterans were not eligible for healthcare. Well, March 5th, 2024, they expanded that, that legislation. And when they expanded it, they have given millions of veterans access to this healthcare. What is healthcare, right? Can we understand what is healthcare? Well, when we talk about healthcare, right, we're talking about regular healthcare, privatized organizations and different things that will always provide you, right? Again, Blue Cross, Blue Shield, so on and so forth. Well, when we're talking about that type of healthcare, you always need typically copays that you will need, right? There's also going to be networks that you can only to be able to utilize certain facilities. Well, when we're talking about the VA healthcare system, we are a pretty large group, right? Over 20 million strong and pushing, okay, give or take, right? So with that being said, we have access to healthcare around the world. So collectively, they have opened that up for millions of veterans, okay? So that means you're gonna be covered for private treatment, medical services such as surgical procedures, okay? Pharmaceuticals, and also making sure you have access to private community care, okay? We'll get into what community care is here shortly. But those are the main components I want to let you know that you have access to. So if you're dealing with those headaches that you've gotten from burn pits or being overseas, if you're dealing with an eye condition that you may feel as though that you didn't know how your vision got worse so quickly, if you're dealing with again that respiratory condition, your allergies, okay, again your nose running, again headaches, vision issues, vision loss, blurriness. There's so many different things. If you're dealing with these things that have been caused from your time in service, well, guess what? You have access to that healthcare, and I want you to make sure you get access to that healthcare immediately. So again, how you are going to sign up for the VA healthcare is going to be very simple. We're going to make it very simple. Now, below in the attachment are going to be a form called a 1010 easy. All right. 10, 10, easy. This form is to be able to give you access to the benefits that you oblige. Okay, so you're going to fill out this form. And when you fill out this form, please make sure you complete all justifiable, areas. And you can, 1, fax it to the VA. 2, you can send it by mail. Or 3, simply log into va.gov and be able to fill out each portion of information there, okay, and submit. But you're going to need your DD-214 with this, okay? You're going to need your DD-214 with this. So whether it's fax, mail, or again, send it in through va.gov, you're going to need your DD-214. So if you do not have access to your DD-214, please, again, we're going to also provide you that resource as well to be able to garner access to your DD-214 as well, all right? So what do you do thereafter you have garnered access to healthcare? How do you know you're approved? We would think that we're going to receive a letter in the mail, typically a notification letter in the mail notifying us, hey, you now have healthcare. As much as we love our government, however, there's some aspects that is kind of missed, and this is one of them, okay? So a lot of times, if you receive a notification or if you're approved, typically you do not receive a notification of approval until months later. Or you may not receive one at all. So what do? So we're going to go ahead and pick up the phone and give, the VHA National Headquarters a call, okay? That is located in Atlanta, Georgia. Then you'll go ahead and give them a call just to make sure that you have access to VA healthcare. And when you have access to VA healthcare, I want you to understand that you need to make sure you set your specific location to be able to provide you a primary provider. Because if you have access to VA healthcare and they have your address in Puerto Rico, but you live in Oklahoma, I'm sure you're not going to fly to Puerto Rico to go get your primary care treatment, are you? Well, guess what? We need to make sure that we do that, because if they do take on that information that you've provided them, they're not going to they're not going to take an extra leap or extra mile to make sure that you are in that locative area. Okay, so please make sure that you are putting, 1, the specific location of where you want your healthcare needs met, and 2, your specific updated information, phone number, email, state, mailing address, and home address. After you've provided that, again, you're going to go ahead and give them a call to see if you have access to healthcare, provided that information. And now, look, we're cooking now. We're cooking. So since things are bubbling up and we're cooking, we almost have our access to healthcare. We need to go ahead and set our first appointment for a primary care provider. All right. So again, we're typically going to be assigned a primary care provider, or we're going to also be assigned a primary care provider. Again, I know a lot of you guys are used to being voluntold, but on the civilian world, you have the freedom to choose who you like, all right? So with that being said, at that point, you need to go ahead and make sure that you choose the primary care provider that's going to be solely and directly for you. But when you do that, let's do a little bit of research. This is your health. Let's make sure this primary care provider actually cares about your health care, okay, your healthcare needs. Let's make sure this primary healthcare provider is going to specialize in things that you may suffer with. Because if not, you will have access to community care, right? So once you pick your primary care provider, what is the next best thing that veterans want after that? You know what they want? They want their VHA healthcare card that has their picture, has their information there, so they can go receive those discounts. So you need your VHA healthcare card, okay? So with that, you want to get your identification card that's going to give you access to the VHAs, okay? And this card here is also not, if you are service connected, even if you're 0% or again 0% or more, You'll have access to military installations to be able to shop at the commissary, BX and EX, so on and so forth. So please make sure that you get that identification card. Now we set our appointment. Now we can be able to set our appointment. When we set our appointment, okay, I want you to understand to make sure that it is going to service you and your schedule, okay? The VHA is 24/7. Appointments are going to be always revolving, but you want to make sure that you have, again, all the information and all the time that you need to get to these locations, okay? Even if they're a drive, you know, some of these locations will be one in a pretty much a 10 to 15 mile radius typically, because you have clinics, you have hospitals, you have satellite locations, you have several different locations that you can access, okay? So with this access of healthcare, even if you have an emergency, you will still have access to the VA hospital or even your local hospital there. But a huge caveat, huge secret, you need to make sure that you contact the VHA immediately, at least 72 hours after your emergent care. Okay, 72 hours. Please contact them. Please let them know that you were hospitalized or in need of care, and they're going to send it to the VA so it can be covered. You don't want a $27,000 bill in the mail. Okay, just pick up the phone, give them a call, let them know that you're in the hospital. If you can't, please have your beneficiary or your support system go ahead and give them a call as well. So going to in-person care outside of the VA, you need to make sure you're reported, okay? I'm just gonna close it there because though it is important, we wanna focus on the care, okay? Typically, when we're talking about the VA, they're gonna make sure that they're able to assist you, but you don't wanna get that bill, as I mentioned before, right? But in regards to that, well, when you are getting your health care, right? When you are getting your health care, there's going to be certain priority groups that is going to be seen first, and also priority groups, not only if you're seen first, but what priority group is going to be assigned to you, whether if you get copays, whether if you get access to inpatient treatment, when you're being treated, and certain things of that nature. So there's different priority groups, okay? We're not gonna go into the in-depth detail of a priority group in regards to what is available to you, what's not available to you, so on and so forth. That's gonna be in, again, our information below, our attachments below, so you can make sure that you can be able to pull that, research that, understand that. But we do have a video that we're gonna make sure that we provide to you guys to kind of navigate priority groups. However, when we are talking about priority groups, all right, the determination of a priority group may be outlined into so many different factors, right? Number one, what is your military service history? What is your military service history? That's very important, okay? Because it will put you in a different position of priority group. We just talked about the PACT Act and how it was very expansive and opened it up for millions of veterans. Well, your priority group will make a determining factor if you are not within that PACT Act legislation, okay? So military history. Also, service disability rating, okay? You want to know what your disability is going to be because it's going to place you in a certain priority group, okay? When we're talking about healthcare here in America is very expensive, and we understand, well, if you're a veteran, why don't you have the benefit of being able to receive your healthcare, either not free, but at a discounted rate? Well, this is why, because you didn't apply for your VA healthcare, utilizing all the forms available and also getting assigned a specific priority group. When we're talking about disability, you typically want to be 10% or more to be able to receive the treatment, okay, the treatment for those disabilities there, and also for service-connected and non-service-connected disabilities. but on average about a 30% is, 50% or more is going to clear you regardless of whatever priority group you're in, that you will receive primary care treatment, specialized treatment, inpatient care, just everything, okay? So that's the goal, right? That's one aspect we talk about in our benefits course, which again, we're gonna really touch on that in that component, but when regards to healthcare, 50% or more, that's where we typically wanna be, all right? Where you can get, again, treatment for service-connected and non-service-connected injuries with what? No copays, right? No copays. So again, and that's always going to put money back into your pocket and for you and your family. Your income level is a huge component, okay? So there are income metrics that the VA set in regards to what you can and can't make for eligibility in regards to healthcare, okay? In regards to healthcare. So again, income plays a part, okay? Income plays a part. The other component or criteria would be specifically if you qualify for Medicaid, right? If you qualify for Medicaid, that is again, another government sponsored insurance, right? So if you qualify for Medicaid, well, why won't you have eligibility for the VA and to be able to be exempt from some of those copays that you may or may not, pay with your Medicaid eligibility insurance, right? Well, again, the VA, that is going to be kind of, should be taken care of, right? But again, those are kind of some of the main components in the priority groups that you'll be set. I want you to understand the priority groups are set from 1 to 8. In these priority groups, they have different criteria on obviously what you will receive and also timeliness of care and also other things, other components such as copays, right? Copays is a huge aspect of why a lot of veterans don't like using VA, right? Because of the copays that they receive. But let me tell you, typically, again, if you are a service-connected disabled veteran, typically copays, that's something that you do not normally pay, okay? But again, we'll definitely be able to give you the priority groups below, and you'll be able to kind of see if you fit that criteria box, all right? Priority groups, when you access your healthcare, you want to know what priority group you're in. You want to know if, again, you are paying copays or if you are not, and you want to be assigned your primary healthcare provider, okay? That is the main thing, all right? We spoke about eligibility earlier in the video, right? And we want to always make sure that we're providing full context. Because again, this is the Veterans Learning Center, right? Veterans Learning Center. So how can we provide impact? How do we provide impact? By giving you one, context, but also progressive, actionable steps and understanding for comprehension, right? So when we're talking about eligibility, I want to go and circle back in regards to eligibility because it's very important. Right? Let's be concise here. So eligibility, it is going to be something that is black and white typically, right? But, well, when we're talking about the VA healthcare eligibility, though it is black and white, right? If you are enlisted in service, typically, again, 1981 and thereafter, right? 1981 and thereafter, specifically October 16th, okay? If you enlisted then and thereafter, you would need 24 continuous months of service to be eligible for VA healthcare. But now, when we talk about that, there are qualifying incidents that will go ahead and meet that minimum requirement of duty, right? Let's talk about a hardship. Let's talk about hardships. What does qualify a hardship is going to provide you, right? We all understand, again, as we're veterans, right? When we got out of service, we always seen someone, or we always we were the person who took a early out, right? Based upon a hardship. So when we're talking about hardship, there could be financial hardship, there could be medical hardship, there can be again, it's just a full array of hardships that's provided. Even social hardships, right? Socially adapting to the military is really a difficult thing to do, right? So that will qualify as a hardship to provide you an early out, right? So that will meet the requirement for a hardship and discharge. Another component would be specifically to be discharged, right? When you're discharged, but you're discharged because of a disability, right? Because of a disability. Well, does it necessarily need to be service connected? No, it does not. But it must be caused or aggravated by active duty or while you were in active duty. So that will provide the minimal criteria of the hardship that's going to be needed to give you access to VA healthcare. Okay. So when we are talking about that, we need to make sure that we understand that is the minimal components of guaranteeing you eligibility to VA healthcare. But with that being said, like I said before, we always want to make sure that majority of our veterans have access to this. If you were a veteran that have inter-service prior to 1981, typically you're going to be eligible for VA healthcare benefits. Okay, it's again, no need to go through the criteria. Typically, you're going to be eligible. Okay, so I want you to understand that definitely if you're exposed to what hazardous toxins and different things of that nature. So I want you to understand that. So those are pretty much going to be your eligibility requirements. But now when we find out that we're eligible for VA healthcare, what are we necessarily going to want to do when we with the VA healthcare, right? Well, typically it all depends in our health, right? We're individuals, general individual people would need different healthcare services. So whether if it's going to be inpatient care that's going to be needed, outpatient care, primary care services, medications, right, pharmaceuticals, and specialized care, and also surgical procedures, right? So many different components are going to be needed based upon health needs, right? But with those health needs, what do we factor in? Sometimes we need to factor in copays, depending on what priority group that you lie. Okay, so with these copays, right? With these copays, I want you to understand that the copays will be based upon your priority group that you are set in and also the tier of healthcare. Okay, so with that being said, let's talk about copays. All right, so let's talk about the copays, right? When we're talking about copays, we understand that copays is a general deterrent from healthcare needs and healthcare services. We were talking about healthcare needs, right? You may need a healthcare for yourself that may have a surgical procedure that could possibly, if it's a private care or even TRICARE, you could receive a bill that's $200, $300, $400, right? For a copay. Well, let me tell you about a special group of veterans that a new policy was just passed for, right? So for copay exemption, okay, that was recently passed beginning April 4th, 2023. I want you to understand that American Indians and Native Alaskans, all right, are exempt from copays, okay? So they're gonna be exempt from copays. They don't pay any copays any longer. And that's already dated back to January 5th, 2022. So if some of you guys received a refund check from the VA or something of that nature, or a check over the VA that would typically add up to these collection of copays, since then, that's what it's about, okay? So again, let's go ahead and get back to specific copays for all of our other veterans. So when we're talking about copays, there's going to be so many copays, right? So many different types of copays. We talk about urgent care copays, which we just spoke about, right? What is the time frame that we need to speak to the VA if we have had an emergent issue and needed to utilize hospital care? Well, 72 hours. You're right. You're correct. 72 hours. So understanding that there are copays that are going to be needed based upon the priority group you're in. So urgent care copays, there are going to be inpatient care copays, there's going to be outpatient care copays, there's going to be geriatric care copays, there's going to be so many different copays that's going to be based upon your priority group and your priority needs that the VA is going to render and bill you. So if you don't have that intact and understanding of that, it's hard to know what's coming to you to be proactive with it. But again, you can always obviously pull the content that we have available here to make sure that you're able to understand what your priority group is and also understand what co-pays that you would need to plan for, okay? Proactive information is better than reactive information. So we're gonna do it together, all right? So as I mentioned before, so copays, that is gonna be based on the priority group, and how we figure out our priority group is, again, it's gonna be based upon our eligibility of care, also understanding if we are service connected, and also what the VHA sets us as, okay, on our initial NDOC, okay? Obviously that can change, right? Becoming service connected or not, but again, you always can go down to our other course and maximize the VA benefits and being able to be service connected, right? That's a total different conversation, but we're gonna stick back to healthcare, right? So when we are talking about the copays, we also want to understand that these copays are going to be vigilant or billed based upon your service needs, where you receive your care, if it's the VA, if it's the VA or VA approved facility, okay? And also specifically if you need a medication, right? So there's a lot of things to factor in when we're talking about copays, where you will always have a breakdown of an explanation of billed benefits, okay? You always want to ask for that. You always want to make sure that that is there, and you always want to make sure that you're billed properly in a proper priority group, right? So, but with that being said, one great thing about this, again, we always talk about the money going out. Well, let's talk about the money coming in, okay? In regards to VA healthcare. So we talk about reimbursement for travel to these facilities. So you are going to be able to receive a reimbursement check or deposit by being able to travel to these VA facilities, hospitals, clinics, or again, a non-VA community care providers. Well, you actually are going to be reimbursed travel pay. And I know if you're a veteran that had to go TDY at any point in time, that travel pay is always that extra kicker. But in regards to healthcare, this is something on a continuous basis. So you'll be able to receive travel pay going to these facilities, okay? Currently, they charge about 41 cents a mile and they reimburse you about 41 cents a mile in 2024. Again, this is a 2024 video, so please, if it's a little off here in 2027, 2037, or 2047, because I know you guys are going to continue to support this, right? But now, again, they charge 41 cents a mile, okay? So you're going to be reimbursed that based upon the care that's going to be needed, whether if it's specialty care out in town, whether if it's specialty care in a different state, okay? Because some VA facilities do not have the means to be able to receive some proper care. We're veterans, and we're one of the largest fraternities, right? We're one of the largest groups that actually are spread across America, and sometimes we're in rural areas. So it's hard to receive the basic care and needs that we're gonna need. So if you are traveling 45 minutes, 55 minutes, or what have you, that mileage is gonna be able to be added up at 41 cents a mile, okay? So that is something to consider. But again, when we're talking about pay and travel, that includes driving, flying, also meals and lodging. Meals and lodging, right? So there's a full aspect of receiving care from the VA, all right? So we want to make sure that you receive that each and every time that you go in to the hospital or the clinic or what have you. You have 30 days to make your claim. 30 days to make your claim. You can actually make your claim, one, in the VHA itself, or you can make your claim online, right, at va.gov. So you want to be able to make your claim, get your claim processed, and now you have that additional income of just traveling to the VA. I know sometimes it doesn't seem like much, but let me tell you, it adds up. So with reimbursement, with copays, with VA healthcare eligibility, priority groups, community care, we can go on and on and on and on about this. And we're going to make sure that we do go on and on and on about this. So you provided the information, the value, and also kind of the inner workings, right? Because if you don't have the inner workings and the nuances to be able to navigate this VA healthcare system, sometimes it gets a little convoluted. Many times veterans walk in and say, hey, I just received free care. The next thing you know, you get a bill at the back of it. Well, we don't want that to happen to you. We want to maximize your benefits. Always understand that this veteran learning community is to maximize your benefits at all aspects, okay? Healthcare, education, disability compensation, VA home loans, real estate investments, entrepreneurs. There's so many different things that we're going to cover here. But in regards to VA healthcare, I hope you found value in this video. I hope you found understanding, and I also hope that you found comprehension. Because if you haven't, please go back to 0 minute and 0 seconds to run it back through, because you have this available to you. Because before anything, we want to provide you value, understanding, and education to make sure that we're eradicating this complex system that is never gonna be an easy process. So with that being said, please continue watching, and we're happy to service you. Please continue to engage in our VA Learning Center. With that, please, we're gonna make sure that we're continuously providing you the education that you deserve. Thank you so much.